Hi, everyone. I can see everyone joining. I'm going to give everyone a second and then I'll kick us off properly. But it's nice to see a number of you joining today. Okay, well, why don't we get started? I'm sure others will continue to join us. I'm just going to start saying that we are recording this session. So if you don't want to be on camera, please do take yourself off. But we'll be using the chat facility and also being able to ask questions live in person if you wish to. But I really appreciate you joining us today. My name is Yvonne Diaz, and I'm an ALK positive lung cancer patient. Basically, like many of you, I became involved in patient advocacy following my own personal diagnosis of ALK positive lung cancer in 2021. My professional background is in PR and communications, and I felt it was a good idea to put my skills to one of the biggest PR problems out there, which is basically lung cancer. So I've been involved in a bit of patient advocacy. I'm still very early in my journey, and I'm really excited today to have two of what I think of as the legends in lung cancer advocacy, Jill Feldman and Dusty Donaldson, with us today. These ladies, their combined experience is just enormous and amazing that we can have a chat, all of us together. I wanted to also just share that the genesis for this program came from I was a lucky recipient of a patient educational award from the IASLC. And I got to go to Singapore last year. And as part of that, you have to put together a project. And I thought, why not continue the subject on patient advocacy? I felt it was the most amazing experience to learn, to connect with people, to attend the sessions, see the research firsthand, and meet so many others. So it's really a great opportunity for all of us to get more involved. I know many of you are already doing lots of things out there, and really all of us can share our experience. So I thought I would start off by asking Jill and Dusty to introduce themselves briefly. We're then going to do some polling to find out a little bit more about who's in the audience. I'd also like to ask any of you to please introduce yourselves in the chat. Just maybe share what your connection to lung cancer is, and anything you're interested in as well. So Dusty, why don't we start with you?
Sure. Thank you so much for the opportunity to do this and to share my passion. So I am a long-term early stage lung cancer survivor. I was diagnosed in 2005. I had just about 10 days before that been turned 51 years old. I had stage 1B, had surgery to remove a 5-centimeter tumor, 2 lobes of my right lung, adjuvant chemotherapy, and I have had no evidence of disease since. So I started this foundation to advocate the Live Long is what is what my nonprofit is. But then I also am the president of the Lung Cancer Action Network, which is an association of all the nonprofits with a focus on lung cancer, all the US-based nonprofits with the focus on lung cancer. And we collaborate and work together. And I can't wait to talk more about some of the advocacy things going on. Thank you.
Wonderful. Jill.
Hi, everyone. My name is Jill Feldman, and my story's a bit different than most. I actually was an advocate before I was diagnosed myself. I had lost my 2 grandparents and my dad to lung cancer when I was 13. And then in my 20s, both my mom and my aunt died of lung cancer. And so rewind to the year 2000, after my aunt died, I was a hot mess, and desperately the internet was somewhat new to me, and I searched for a walk, a support group, an event, an organization, and there was nothing. There was no community at all. And I always say coincidence or fate, the first organization in the country, in the United States, dedicated exclusively to lung cancer research, was founded in my community. And I got involved shortly after it got off the ground in 2001. And so, just a little bit background here was there was no organization, and one thing that remains with me that I think about all the time is one of the founders whom I never met because she died before I got involved, but she was a 40-year-old mother of three who was in the hospital on a respirator, actively dying, but so desperate and so determined to create something that she used a whiteboard to communicate until her last breath. And I really hold that close to my heart in the advocacy that I do. And her mother is the one, of course, who told me that story. But the other control I had was to be my own advocate. And so I started getting scanned. And in 2009, I was diagnosed. I was 39 years old. My kids were 6, 8, 10, and 12. And so my, at the time, my advocacy started to kind of change and the community started to change. So I got involved in some other things, and we could talk about that later, but it's really been a privilege to be a part of this community and to, advocate for all of us so no one has to go through this alone.
Thank you so much, both of you, for sharing your connection and background. And I'm really looking forward to this entire conversation because I already have lots of questions forming in my mind. And I'd like everyone else to also just feel free to put your questions to Jill and Dusty and use the chat, and you'll be able to also ask your questions live if you prefer. But before we do that, I'd like to find out who is in the audience. Thank you for those who are already introducing yourselves in the chat. It's really nice to see where you're from and what your connection to lung cancer is. But I'm also joined by my colleague, Summer Farman, a fellow ALCI, who is going to help me with the polling. So Summer, if I could ask you to please run the polling for us.
I sure can. It would be my pleasure. Let's get started.
Okay, so you hopefully are all seeing the chat right now. What best describes you? Living with lung cancer, caregiver or family member, or maybe just another connection, whether you're in industry or just another connection to lung cancer. Summer, can you see the poll results, please?
No, I actually don't. I don't see it.
Right. Okay.
This is the fabulousness of Zoom. No,
All right.
The next one.
Should we move to the second question? What do you think?
Yes, let's do that. And in the it looks like in the chat we have a mix, and that's so great that everyone's introducing themselves there, Yvonne, too.
Yeah,
So.
thank you. Please do continue that. Okay, we'll give poll number 2 a try, and if it doesn't work, we can abandon number 3. So hopefully the second poll. Dana, are you seeing that?
Yeah, still not. I think we needed to stay with the same.
Okay, why don't we abandon the polls? Sometimes the tech gets the better of us, but we were going to ask a little bit about, and maybe just use the chat. So, feel free to put this in the chat, but we were wondering what best describes your patient advocacy efforts to date. Are you motivated but not yet started? You've been more so focused on sharing your story. You're active maybe on social media. Perhaps you've done some public speaking, or maybe all of the above and more. So if you feel like it, maybe add some of that into the chat and we can come back to that. And then the third question was around what parts of advocacy most interest you? Is it really creating awareness? Is it advocacy for research, behind the scenes on trials, policy, things of that nature, the public speaking, or anything else? Again, just adding that. So yeah, let us know a little bit more about you, and really I'll just get into some of the questions. So I'm going to start with Dusty, and I read in one of the profiles on you that you had never considered a life in advocacy. It was your own diagnosis in 2005 when you were enjoying a great career in journalism and media relations, and you were also a busy mom that you were diagnosed. So I think one of the big hurdles for any of us considering advocacy, especially when you're navigating your own disease, you have your other life, right? How do you get started? So you've done a lot to educate other patient advocates, and I think that's so key because a lot of us, we're really learning as we go. So maybe you can share with us what you do in this space, any resources that you would recommend.
Oh, sure. before I talk a lot about what I'm doing now, I'd like to go back to that time, because back then when I was just getting started, I didn't know how to advocate, and I was working full time, and I was also in a fast track MBA program. So actually the day of my diagnosis, I happily dropped that MBA program because it was creating a lot of stress in my life. I got rid of that. So, but I realized at my cancer center, a comprehensive cancer center, they didn't even have materials in their resource room about lung cancer. And so that was one thing you just see an unmet need. And so in my case, it was very, very local at the cancer center where I was treated. I became a volunteer at the cancer center. And I knew there were organizations that produced materials for free, educational material. So I was able to bring that material in so that the next lung cancer patient who came in behind me had resources. So it can be as, it as small or insignificant, which it's really not smaller or insignificant. It's actually quite time consuming to become a volunteer at a cancer center and then to, commit to that every week, or however often to volunteering there. So that was time consuming, but it was rewarding. And then I've since learned almost every cancer center still has that unmet need. They don't have the resources that they should have for lung cancer patients. But at any rate, just finding your own passion, I think, is what's so important. Because you were mentioning your skill sets, that was a beautiful fit for you to go into using your skills, your communication skills, and your public relations skills to, educate people. And we have similar backgrounds. Mine was in journalism, and then I went into media relations, corporate communications. And so I thought the same thing. I'm like, it's my destiny to do this. And it's almost as if the previous 20 years of, professional work was developing me for this purpose. And I don't want to put any words in Jill's mouth, but I dare say she had a similar experience. But at any rate, wherever you are, your resources, your circles of influence, you can use for advocacy, as well as, taking another leap into an area where you might not even know that you have skills. But I'm going to stop now and let you maybe ask Jill a question.
That sounds great. And yeah, there's so much richness to dive into everything there. And I appreciate you going back to the beginning and taking us through that. So Jill, I also want to congratulate you on your Patient Advocate Award from ASCO. We're just fresh back from ASCO last week, which is the American Society of Clinical Oncology. And really, it was amazing to see patient advocacy being recognized on the same stage next to investigators, clinicians, others across oncology. So it really shows the value of the work that you do and really the work that all of us are trying to do here. And I've been following you really since I got involved, because I think you have this amazing way of zeroing in on the key issues, right? I've seen you speak on these and press coverage as on the back of it, talking about everything from, moving from maximum tolerated dose to the minimum effective dose, right? Many of us think about that in our own daily lives. We're given that max dose. Is that the right dose for us? So how do we push that forward? You're always reminding researchers about all aspects of trial and that the real endpoints are the survival of us, the patients at the end of the day, right? It's not whatever it might be on paper. So, I mean, maybe you can tell us a little bit more about how you pick up on these issues. You must be having your ear so attuned to everything that's going on out there.
Yeah, yes, thank you. I just want to start by going back to kind of what Dusty said in terms of purpose. And there's this quote that is, if you want to find your purpose, find your wound. And so, I think that's why we all get involved in advocacy, really. And, and add that purpose isn't static, it's really dynamic. So I started out, again, just trying to raise awareness, get people to care about the disease, fundraising, which I did not like, but there was nothing else. I mean, we were just trying, we had one event. And so advocacy is, it's really, it evolves personally, just as it has on the big stage. And it really changes as you kind of, go along in your experience and learn new things. And so, I think for me, one of the things that when I first got involved, it was all about saving lives. Like, I mean, my parents died months after they were diagnosed. That's what it was. And now, as time kind of went on and research was advancing, what I kind of realized that what often got lost in the research and science is that behind every data point is a person whose life and whose family is profoundly impacted beyond statistics and survival. And so, it really being able to listen to the community, to all the patients in the community, the good, the bad, the ugly, and my own personal experience, but kind of recognizing what was going on behind the scenes. There was a disconnect with what researchers were doing. So really, the overall is emphasizing that overall survival is not the only important endpoint to us. It's not enough to just survive. We want to live. And so there are so many, things underneath that and areas where I've gotten involved. But I would say, I've learned that, I'm not going to change the system in my lifetime. It's really about learning the system and making it work for you. And I think, I thought about, it wasn't just about what I wanted to do. And by the way, FYI, I am a journalism, business communications major with a master's in education. Science and math were my worst subject. So it's really understanding then what can I do in the research space. And I saw things that were ignored, dismissed, or not valued, yet they were important to us, so everyone else was paying attention to other things. And, I just tried to, again, take the science, and you have to apply it in the context of people and, taking that approach. And that really is how, I kind of, found that niche and what I do.
Sorry, just coming off the mute there. That's amazing. I mean, there's so much packed into all of these discussions, and I wonder if maybe we take it back to the beginning. I've seen some and to kind of when you're getting started. So some people on the chat were talking about that they're starting with sharing their stories. Some are getting more advanced and already honing in on their skill set, like looking at data, getting more into PROs. So and the time has moved on. I think, Jill, we're so lucky, and really with both of you, Dusty, when you both started, like you said, it was a different landscape, right? Patient advocates weren't part of the scene at all. So in a way, the work that you help, create it really welcomed us in, but we're still not there yet. So how can people get started? Any top tips you have there?
I'll jump in on that. So there are, as many ways to advocate as there are advocates. So just, I would suggest a couple things just off the cuff. But one is, start working with an organization, a nonprofit organization that's doing advocacy, especially if it's something that you're already interested in. But number two, I'm going to say, don't embed yourself exclusively with one organization. Like I said, the Lung Cancer Action Network, we work with all the organizations, and as survivors and care partners, you can move in and out of these organizations. And I would say, Jill, you might remember the days when early on, like if you were doing something as a volunteer with one organization and then you did something with another, they treated you as if you violated your marriage oath or something. And it's not that way now.
Yeah.
So we
Right.
can move about freely, and we should support when it's something interesting going on in one organization, then jump on it, and be better for it. But you can do legislative advocacy. I love that. I love going to Washington or writing emails or letters to the editor, but legislative advocacy where we can usually try to increase lung cancer research funding. That's a passion of mine, but I have many. I am very passionate about lung cancer screening. And surprisingly, I'm finding not as many of the advocates are as passionate as I am about screening, but I'm an early stage survivor, and I want everyone to be an early stage survivor. So I really, the uptake on lung cancer screening is dismal and inexcusably dismal. So that we're doing all kinds of things to raise awareness. We're not just going to health fairs, which that's fine, but we realize that people who might be good candidates for screening, they're at the barbecue festival, a hot air balloon festival, a music festival. And so we're going to those places with information about screening. And we go all kinds of different ways we reach to the public with that information. But then, you can do something as simple as just wearing a lapel pin or, displaying a white ribbon. I don't know if you can see mine way in the background, but, just something, or wearing a t-shirt even. I mean, those are conversation starters, and you'll be amazed at the number of people who come up to you and say, my father died of lung cancer, or my mother has, or something like that. So it can go to so many different degrees and levels. I would also just, I don't want to say caution people, but in the beginning, you might be overly enthusiastic, if I may. And I just want to just say, be careful not to put your health at risk for the sake of advocacy, because your own well-being and peace, your inner peace, is frankly, it's of value, and you're not going to do as much advocacy if you're unwell. So take care of yourself. Do your advocacy, but almost treat it like a job. And I know there are some workaholics who go crazy and do, work 18 hours a day, but not that kind of a job. But just think about it as a job. Put it in a place, and in your schedule, and work it and enjoy it. Do the things that you enjoy. Jill mentioned fundraising. I do not like to fundraise. And there are people who enjoy it. You know what? We need those people big time. But anyway, you might want to review research proposals like Jill. Science. I got a D. The only grade I got a D in college was science, was biology. And here I am reviewing research proposals. I mean, how ironic is that? But there are so many ways to advocate. And, it could be just, helping with a Zoom call, right? Doing the poll or something like that. It can take so many different ways and shapes and sizes that to be an advocate. And it's all very powerful and very helpful and very, very needed.
Yeah, I definitely agree with everything that Dusty said. And, I think when we got involved in advocacy, there weren't many options, right? You just had to dive in and do it. But as time has gone on, it's something you think about, like, I always say, think about, why am I doing this? Why do I want to get involved? And, really thinking about whether there is something specific, and, and going from there. And I think I got my feet wet in a lot of different, areas of advocacy. And I do not like policy. I am not good at policy. And I remember saying that to a few people. Dusty, you were there, and they're like, what? Like, what do you mean? I'm like, it just, I shut down. And so, but I'll still sign letters. I'll still send things to my, senator. I recently had a call with my senator's staff. I gave a presentation to the First Lady's office. And so, really importantly, not closing completely your mind to anything and listening for different opportunities. I think the first way most people start is telling their story, or feeling comfortable telling their story, reaching out to community. I've told people, if you go to an event, if that's all you do, that's a form of advocacy as well. You are supporting, raising awareness, raising funds. In a few things to add to what Dusty said is getting involved with like your local hospital, even, November is Lung Cancer Awareness Month. What do you do for Lung Cancer Awareness Month? And if they do nothing and you want to do something, the large organizations have toolkits that can help you. I think if what really is, I think the best way to learn is talking to people. The cancer community in general is amazing. Like Dusty and I know amazing advocates, pan-cancer, but our community is really special. And I'm not saying that just because I feel that way. I'm saying that's what all the other communities say about us. The way, the collaborative efforts, the, way people want to help, the way researchers, advocates, physicians, nurses, advocacy organizations, all stakeholders will take time to talk to you. And I do that all the time. And in the beginning, I was very timid. But yeah, I reach out to people all the time. I'll send them an email, I'll message them, say, hey, I saw you did X, Y, and Z. I'm really interested in understanding, the work that you did and what you've learned, and see whether there are synergies or not. I think that is, really, and again, it can be an advocate, it could be a physician, it could be within the policy world, it can be, whether maybe you want to work with industry, maybe you want to work with the NCI, maybe you want to just work within the community. It's really learning from other people that I think is the most important thing. And the other is you may be good at something, but that doesn't mean you have to do that in the advocacy space. You need to do what gives you energy, not depletes you. If it depletes you, it is not doing anybody any good. And it's not going to, make you feel energized or motivated to move forward. So that it's okay. And the other thing, it's okay to say no to things. I had a really hard time with that for a very long time. I still do, but I always, it's okay to say no. That doesn't mean that you're not going to be asked to do something else. And the other caution is, just don't ever let anyone exploit you. I mean, you know, everybody has a story to tell. Every story matters. Every voice counts. And I mean that from the bottom of my heart, because the strength of our community is that tapestry of stories, every thread, every color. That is how we are where we are today. And so that was something that I still struggle with there and there. Like, do I have imposter syndrome? I mean, recently, I was invited to co-chair the AACR annual meeting. I sent an email back and I said, hi, Dr. Fody, I really appreciate, the email, but I think you have a mistake. I am a patient advocate, not a researcher, because AACR is basic research, like not clinical, not like ASCO, it's basic research. And she emailed back and said, I know, Jill, we didn't make a mistake. We want patient advocate voice. So it's normal to feel that way. But it's, I really think that there are so many different things to do and so many different ways to get involved. It's really just kind of learning about each one of them through people in the community. Those connections are by far, I think, the most valuable thing, and the friendships, obviously.
Oh, it's wonderful. I mean, both of your advice, there's so many things in there. I want to come back to 2 points that each of you said. Dusty, actually, one of the points came from also a conversation that you and I had, and what you were saying earlier just reminded me of that, because we were comparing advocates for breast cancer and prostate cancer have just done such a phenomenal job. And you think in lung cancer, here we are, the largest cancer killer, but still far behind. I think you said what the breast cancer advocates did really well was involving the families. And I think sometimes there is so much pressure put on us, right? Where many of us are stage 4 in lung cancer. We're managing our disease, trying to earn a living, right? There's so many challenges, like you say, and not being exploited. All of these things are so important. So I don't know if you have advice and what we need to do more around that, but I think that's so true. We need to get coworkers, family, whoever behind this.
Yeah, absolutely. And yeah, I mean, not to pit one cancer against another, obviously. However, when you look at the breast cancer advocacy community, I mean, they are mighty, and look at their funding. They get funding from corporations that have, no vested interest per se, but they do want the image of supporting breast cancer, because that will, in their mind, that will, it's better than advertising. But in lung cancer, the only funders we have for in the nonprofit community, really, virtually the only funders we have are industry partners, and that means pharmaceutical companies that have a drug in the lung cancer space. So it's ironic because we're functioning at a limited level with the funding, and yet we're leading the way with the biomarkers and the targeted therapy and the research. I mean, 10 years ago, we were not, but now we really and truly are. And now I used to have breast envy. I had breast envy when I was a young girl, and now I have it again, but actually it's going away now. And the breast cancer folks are, looking at lung cancer, and I'm talking about in the research space, and they're saying, well, you guys are doing phenomenal things. And so that's exciting. And I apologize, but I kind of forgot the question. Oh, so the breast cancer advocates, they get their sisters, their mothers, their brothers, their boyfriends, and they all, proudly wear the pink ribbon and so on, and advocate and do the walks and whatever else for breast cancer. With lung cancer, as you know, even if someone has no history of smoking, that stigma gets stuck on them. The very day I was diagnosed, somebody slapped it on me and I wore it for a while. I don't anymore, but he just asked me about, he said, I didn't know you were a smoker, or did you smoke, or something like that. And I was really taken aback by that. It doesn't bother me anymore. I recognize it as a teaching opportunity, and I've got a good answer for it. So I use it and welcome it now. But it's just, that stigma also sticks to our loved ones. And it's difficult to ask your loved ones to hold their head high and advocate and support lung cancer. I mean, I say it's difficult. It's just that it's difficult because I don't want them getting smeared with this stigma. That's why it's difficult. My family has been phenomenal. They have supported me, from the get-go, and done so many events and everything, but it is a lot to ask of them. And yet it's going to take that. And I'll tell you I think those patients who are stage 4, it breaks my heart when I see them advocating so passionately. I mean, it's like those early stage survivors, we should be carrying the heavier burden and easing the load on those who are really in the trenches fighting for their very health. And I wish there were more early stage survivors who could join the team of advocacy, as well as their family members, their co-workers, and so on. But it's going to take an army.
Yeah, no, that's right. And in the chat, some of the discussions you were having, the points you were making earlier around screening, we're certainly getting a lot of chat there as well. And I don't know if either one of you have more chat. Is it a policy? The fact is that I think a lot of us here on this call would not hit the screening guidelines, right? So screening is great, but we wouldn't qualify for screening. So how do we, I don't know
So
if there's a lot.
there was a presentation actually at ASCO. There's this Taiwan study, and it is on family history. And it showed the breakdown on people, the huge difference when they're screened versus not screened. It's a stage shift, huge stage shift from, stage 4 to stages 1 and 2. And I think that, it is, it's important. I just want to point out the reason there is not universal screening for every single person is that, unlike any other cancer, over 80% of people have something on their lungs. And over 90% of the time, it's not cancer. But you have somebody go in, they have a scan, a nodule is found, and someone says, okay, we're going to look again in 6 months. Nobody in their right mind is going to understand why. So there is a lot of education that needs to be done. But, and guess what? 6 months later, you could go back and it could be gone. Again, over 90% of the time, it is not cancer. So it's really, trying to obviously risk stratification and forget the screening guidelines. Here in the United States, I want to scream. They only update them every 5 years. There is a lot of research going on. And some of it is, I know I'm actually involved in a clinical trial that's about to start for people with a family history of first-degree relative, or, if it's a second-degree relative, 2 or more, meaning it could be 2 second-degree relatives, or a first degree and a second degree, but for first degree relatives. And so, and one of them is using AI to really try to even predict if somebody is at a higher risk for lung cancer. They're doing it in firefighters. And, in going back to the stigma, that's a big reason people don't get screened, don't utilize it, besides I would say, nihilism on the provider side, and not telling their patients about it, but also that, people feel like they're going to be shamed, they're going to be blamed, and that, you're called out if you smoke. It's smoking. And so I do think once we add other risk factors to that list, then, people aren't going to feel singled out, that, they're the only ones being asked to be screened. But we're catching up on that right now. And I think, really the most important part of the screening is, making people feel like they have a safe space, the empathic communication. And there are researchers working on that, kind of with training programs for doctors when they talk to people. I don't know if any of you have seen the IASLC language guide, but the whole purpose around the language guide is to raise awareness about person first, blame-free, stigma-free, equitable, and inclusive language when talking about lung cancer. As Dusty mentioned before, the smoking thing always comes up. And the thing is, it doesn't matter whether you smoked or not, we are all defined by our smoking status. We're either a non-smoker, a never smoker, a former smoker, a light smoker, a smoker. We're not even humans. And so that guide is made to really start talking about people, because, for people who don't smoke and, understandably, because of the stigma, there's this huge need to declare loudly and almost immediately, but I didn't smoke. And what that does is it unintentionally shifts a pretty hefty blame to anyone with a smoking history. And I've actually seen over the years, a lot of people with a smoking history take a step back and say, well, I deserved it. Those people don't. So we really need to kind of unite as a community and start talking about risk factors as opposed to smoking, because there are other risk factors, including air pollution and radon and carcinogens. And, if you're in the military, so many things, or family history. So I think I think that stigma really affects every part of advocacy. It affects policy. It affects research dollars. I've had people say, why would I support a cause that can be prevented or self-inflicted?
Right.
It's just mind-boggling to me. But, as a community, again, I feel like if we start talking about risk factors, and the fact that unless you live in the plastic bubble, then, we all can get lung cancer. And maybe then young people who aren't eligible for screening will listen to their bodies as well, understanding that anyone with lungs can get lung cancer. So I think, that stigma piece, I could go down a rabbit hole, but all kidding aside, it is really a problem. Just quick story. I have an older brother, 18 months older. He suffers from mental illness, but he's been rolling and smoking his own cigarettes since he was 16. He doesn't have lung cancer, but I will have professionals who are against stigma. They advocate, to get rid of stigma, say to me, well, that you must be mad, or, well, that just doesn't seem fair. And I'm like, since when is life fair? Like, that is, unintentionally perpetuating the stigma. So I think that's one thing every single one of us in the community can advocate for.
Yeah.
want to
And
jump on that
I
for just a second. Oh, if I may.
okay. No, go on,
Um,
Dusty. Yeah, please.
Because I know a lot of people, they want to get screened and they're understandably resentful that the screening guidelines don't, are not all inclusive. However, even though the current screening guidelines, and I apologize if somebody cutting my grass outside and if it's too noisy, my cat's meowing, but the screening guidelines, even though it's low dose CT scan, it is radiation exposure. And in fact, it ultimately, if you started early enough and you continue doing it, it could actually cause lung cancer, or at least that's the way it's been explained to me. And so there is do no harm, they say, do no harm. And in some people, it is doing harm, even though many people could have benefited, perhaps many more would have been harmed by doing that. Until we can get a safer way to screen more inclusively, like a breath test, like a blood test, then, I think we need to probably be mindful that this radiation exposure is not zero risk.
Right. No, thank you both. And I mean, that's such a big and important topic. And certainly pointing to the ISLAC language guide, I think is a great starting point. And it's a resource that I think anyone here can quickly Google and find and use that in their own work. Because I think having that consistent framework is so important for us. I'm mindful of the time, and I also wanted to think about what about how can advocates around the world work together across more advocacy efforts. It's really nice to see we do have a bit of an international audience here. I'm based in London. Obviously, I've seen some from a few others from the UK, and we had some Europeans on the line. So I wonder if either of you have thoughts around that, and maybe also some of the resources that are out there, because Jill, you spoke about you're not a scientist. I always think, geez, I wish my biggest regret is not paying attention more in biology class or something. And I do think I have a way with words, but I don't understand the science. So it's not easy to understand. Those researchers are spitting out those research reports in 5 minutes, acronym city, and to move through that at pace to walk away with a basic understanding of was that good or bad isn't always easy for us. So maybe those are kind of two questions wrapped up into one, but if we can pick up on those.
Mm-hmm. Yeah, I think, as far as working together, I think, there obviously all of our regions are different, our coverage is different. But one thing remains the same, and that's nobody can understand the experience except for those who lived it. And I mean both patients and loved ones, family members. So, and I think so really, really getting together some of the things, international projects that I've worked on have been along the lines of, having to do with side effects related to, to the treatments, like really looking at that, looking at the psychosocial, all of the different effects of treatment. We all, deal with financial, physical, psychosocial. Some of it does have to do with clinical trials that are around the world, because that's what industry does. But learning from each other, I cannot tell you how much I learn from other people in other countries. And really, I think one of the most powerful things we can do is collaborate, or at least introduce people to whoever we need to collaborate. And that's something I'm seeing like come to fruition in Africa, and it just makes my heart feel full. So I don't, again, yes, there are so many different issues we have to deal with separately, but learning from each other, using each other's resources. I think sharing resources is huge. And that is really important. As far as the science, it is hard. The acronyms are hard, and that's something else we're trying to change. I'm actually working with the industry partner right now. They're changing their lexicon and how they talk about research. So some of the terms, some of the things they use, absolutely, you use in a certain context. But when it's in the context of data or results that's going to be presented in front of patients and families and the general public, they're changing the way they talk about it in a way that's more easily digestible to us. And I think, and I know we're time here, so I'll say one more thing about that. It took me a very long time to being involved on the research and to not sit there and say, oh my God, I'm the dumbest one in the room, to changing that way, my mindset, and saying, okay, I don't need to understand the up-down regulation, this pathway and all around. I need to understand what big picture, this science, this is what they're talking about, what that means to us and our families. So that, is it important and meaningful to us? Will it improve or prolong our lives? Is it feasible? Is it something that, patients will be able to participate in? Is it, so really looking at it in that context, because, a lot of times, I mean, I can't even think of an example off the top of my head right now, but within research, when we're looking at research and they're telling us that a patient will have to come in, and have repeated bronchoscopies, we're like, no, that's not realistic. Patients can't do that, or you're expecting too much of patients, or that's not important to us, that we need to do research on a drug that's, well, for ALK, spares the NTRK, right? So they don't have horrible side effects. So that's more the way I think when it comes to research, really looking at it, because I promise you, I do not understand it like many other advocates do.
That's amazing. How about you, Dusty? Anything to add on that, or whether, like, what about oop, is someone seeing something strange on screen?
Yeah.
Okay. All right, there we go. Okay. So yeah, any advice on like how to learn and because you've done some training around that and certainly been involved in probably in seeing what's out there in the market. You're on mute there, by the way.
Thank you. Definitely would recommend anyone who's interested in advocacy, consider the IASLC STARS program. And that is definitely more science oriented, and yet it will help you get connected with other advocates who are really on the move, if you will. Now, I wanted to mention also resources, and you asked me that early on, but through the Lung Cancer Action Network, we did a media training program. It's been a couple of years ago now, but it's out there. It's available to anyone. They can access it. It's quite comprehensive, I believe. Jill was part of that. And then we also just a couple of weeks ago, LungCan did another like speakers training, and it was a shorter session, just a 2-hour workshop, but it's available free of charge for advocates. Really, even if you're not an advocate, it's available to you. But I just wanted to make that available, and I can send you a link later. I'll have to dig it out, but it's just one way that you can learn. But when you align yourself with another advocate and kind of let them be a mentor to you, then, because, if there's anything I love more than advocating, it's looking and seeing how other advocates are developing and or mentoring them, and it just gives me so much joy and fulfillment. I just get so excited. I was so proud of Jill when she was up on the stage at ASCO. I cannot tell you, I was just so happy for the whole community, but she was standing there, the tiniest one on the stage, yet she represented a real powerhouse. But anyway, so there's
Thank you.
just getting connected with an organization or another advocate who you admire and who's doing the kind of things that you want to do. Just, kind of align yourself with them and learn from them. That's what I would do.
I love that.
Yeah,
have
I
to
love
also-
that. I first of all, thank you, Dusty. I totally agree with Dusty. And you learn from other advocates, and aligning yourself with them. The other part of that is listening and really trying to think about other perspectives, right? We all walk in with our perspectives, and there's nothing better than when someone challenges me and I'm like, touche, right? I never thought about it that way. And that is the only way, for me, I feel like I have been able to grow as an advocate. And it is, I would say, the most important part of learning and finding resources.
That's wonderful. Really, there's been so much information packed in here. And I have to also, I can confirm, because I ran into Dusty shortly after your opening there, and she was bursting with excitement about your award. So it's absolutely true. And I also want to say, Jill, you've been very generous to me. And I agree, a lot of the best ideas have come from speaking to others. I know you serve as a mentor for IASLC, and really speaking to others is the best way to learn. Going to the conferences, meeting others, even in the patient groups. I think, Dusty, you started off by reminding us, join the patient groups, volunteer for them. You don't have to just volunteer for one, right? Sometimes you have to kiss a few frogs and work out, which is the one for you, but also sometimes it might be more than one. And in this case, you don't have to be monogamous. I think it's nice to get involved. You meet different things. You get different things from different groups. So I think those are all like really, really important there. Jill, sorry, I think you were going to say one more thing.
No, I was going to, I mean, thank you. The award is a tremendous honor, but I did not get here alone. I would not have gotten it if it weren't first for those 7 founders of longevity, but along the way, every single person that I have met who has taught me that I have grown from. It was really a testament to the lung cancer community. Like that, I stood up there and I was beaming for every single person in our community, because I just have had the privilege of being everyone's voice. And but that's how I got there. Exactly what Dusty said, was really connecting with others and learning from others.
Wow. Well, thank you so much for your time today. And I hope everyone who joined, you've been a fantastic audience, and it's been nice seeing all the chat and dialogue as well. And I hope you all took something away. There's been so much information in here. I feel like I need to go back and I'll do the replay and watch it myself just to write down the tips in here. We will be replaying it, offering the replay. So for anyone who didn't get to join, so thank you again. I'd like to finally just close by 2 things, saying that the next and final episode in the series is on Tuesday, the 9th of July. And that's going to be around finding allies and partners. And I have some amazing individuals joining that one. Dr. Amy Moore from Longevity, Dr. Anne-Marie Baird from Lung Cancer Europe, Dr. Ken Culver, who's with All Positive Inc., and Terry Conneran from the KRAS Kickers. So really hope you'll come back and join us then at the same time. And finally, just again, I want to thank Jill and Dusty for being such great guests today, and for sharing all their wisdom, and to Dana and Summer for helping me manage the Zoom. So thank you, everyone, and hope to see you again.
Thank you so much.
Thank you so much. Bye, everyone.
Thank you.
Bye.
Bye, everyone.